Good afternoon, everyone. We have a lot to go through. It's been a very busy weekend for a number of us. I certainly had multiple conversations, including with the governor this past weekend. The governor made some major announcements. I was actually invited to participate in that Zoom call you may have seen, but unfortunately I could not because of a prior commitment associated with what we're announcing today with regards to the Erie County Back to Business program. But I do want to welcome you all. Hope you had a very good weekend and a happy Thanksgiving. As we provide another COVID-19 update for Erie County, we have a lot to go through. So, just remind everybody, we'll be seeing and hearing from Dr. Gail Burstein, our health commissioner, soon, and of course Kendra Schmidt from Deaf Access Services is providing us the American Sign Language. The case data, we have data now through November 29th. As we have the updated data for yesterday, there are 25,479 total positive cases. We'll get into that in a little greater detail. Through the 26th, as confirmed by our Department of Health epidemiological staff, 803 people have died from COVID-19 in Erie County since the beginning of the outbreak. And I do offer my deepest sympathies to the friends and family of those who've lost loved ones. I know that there's quite a number of them that unfortunately have passed in the last few days. We'll go into that in a little greater detail as well, including those who passed on Thanksgiving. So deepest sympathies to the family and loved ones of those we've lost due to COVID-19. On November 28th, there were 386 individuals admitted to Western New York hospitals for COVID-19, and 327 of them in Erie County. Those are, once again, the highest amounts ever. And any one day that both the Western New York hospitals and Erie County hospitals have seen. On the 28th, there were 63 Erie County patients who were in the ICU. 27 had an airway assist, and unfortunately, 11 patients died on the 28th in Erie County hospitals. We do not know if these were all Erie County residents, hence why the death total we have that's definitive is only through the 26th. Our county officials will go through and confirm the residences of those individuals. There may be people from outside Erie County who actually died in one of our hospitals. For the data for the 29th, yesterday, 438 new cases were reported to the Department of Health out of 4,784 reports that were received, for a daily positivity rate of 9.2%. And a 7-day positivity rate rolling average is 7.3%. Once again, 25,471 cases. I don't like seeing the daily positivity rate go up. It has stayed fairly level in the 7% category. Some days have been a little higher, some have been a little lower, but we've seen more days, it seems like lately, with higher positivity rates, which is only going to push that 7-day average up. That's not good. That means there's more people catching it in the community. Diagnostic test results for the past 6 weeks. You can see the big jump up starting after the week that ended October 24th, where we basically had a doubling of the positivity rate and cases from the 24th to 31st, and then a big jump up from the following week to November 7th, another big jump up to the 14th. We're having a lot of new positive cases confirmed per week. We're also doing, as a community in a region, more tests than we've ever done in any one week. There were 53,699 tests completed the week of November 28th with an average positivity rate of 7.0. So there's a lot of tests that are being done in our community, but we're still seeing the higher elevated rates. 9% increase in confirmed cases from week ending 11/21 to the 28th. Positivity rate approximately the same, so that's at least somewhat of a good thing, because the more people you test, you should, if you're doing a good average of the greater community, you should get the same amount in the same week to week. If you are not spreading it to more people, just testing more people, so you're finding out that there's more people testing positive as a raw number, but you want to look at that positivity rate, and that stayed fairly stable week to week, though we're starting once again in the last couple of days to see some creep in the other category. And unfortunately, half of Erie County's cases since the beginning of the pandemic have been confirmed during the past 6 weeks. Information based on zip code in cases per 100,000 for the week ending 11/28. We have a new leader with regards to a zip code in community for the most cases in any one week, and that is the town of West Seneca zip code at 14224. This is not something you want to be leading in. And also, its new daily cases per 100,000 population on a 7-day average is one of the highest that we see. The three highest communities are West Seneca, Hamburg, and Lancaster that have very high rates per 100,000. The next highest zip code, our next couple zip codes are Amherst, Tonawanda, Buffalo, Cheektowaga, but you can see the difference in the cases per 100,000. They're smaller, there's no doubt about it. You want to find a way to keep it below 25 is truthfully best. If we can keep it below 25, then in all likelihood we're reducing the spread. Once we get above 25 to 50, we're seeing growth. When you're above 50, it's bad. When you're above 75, it's really bad. And unfortunately, when it comes to really bad, we have West Seneca, Hamburg, and Lancaster that are leading those. The full list will be released by the Department of Health later this afternoon. COVID-19 new cases, residents for week ending November 28th. As we've talked about, in general, we've seen, even though the city of Buffalo only makes up approximately a little more than 25% of the population of Erie County, it had seen more than a proportion of its actual cases. It was 27.9% of the overall population of Erie County, but throughout the beginning, it's been 40.3% of all cases. That number is actually dropping for the city because what we've been seeing recently is a vast majority of the cases are coming from outside of the city of Buffalo. In fact, for the week ending November 28th, the city of Buffalo made up 32.5% of all cases, while the area excluding the city of Buffalo and Erie County made up 67.5% of the cases. So roughly 2/3 of the cases came from outside of Buffalo. So that just goes to show that the spread and the activity associated with COVID-19 from this most recent second wave is not hitting the city of Buffalo like it did in the first wave. And when it comes to hospitalizations, we'll have a lot to talk about with hospitalizations. You see the huge spike that we've had since late October, in which we just continue to see that blue line go up. If there's anything that we've seen over the last few days, while cases of overall hospitalizations are increasing, there's some days in which we've seen negligible growth. We haven't seen a day in which it went down in quite some time, but we are seeing the continued growth in hospitalizations, and ICUs are not at the level that they were earlier this year, though they are growing. So we want to continue to ensure that the ICU beds are available for not only individuals with COVID-19, but those who are suffering from potentially a life-threatening illness or injury. We can't have those ICU beds be completely filled because there are others who are going to need them. And as the governor discussed earlier today, hospitalizations is going to be a key metric going forward with regards to the orange and red zones. And as I'll go into a little bit more. So on November 28th, you see this is the 2-week chart. We've shown this a lot. It's continued to show growth, though not much growth between the 28th and the 27th. On the 28th, 35% of all patients in Erie County's hospitals were under the age of 65. And we have seen a 125% increase in hospitalizations in the past 2 weeks. This is a pretty interesting chart which goes through 3 weeks of days. So basically you have the 27th, the 20th, and the 13th. These are not weekly totals, these are the daily totals. And you can see the rapid growth in patients age 65 and older during the past 2 weeks, where at one point the age group that was the largest overall was the 55 to 64, and that has been easily surpassed recently as the older age groups become more prevalent in our hospitals, which is not surprising because we know that COVID-19 has a greater impact on those that are older. And as a result of the rapid increase, you heard it earlier today, Governor Andrew Cuomo canceled all elective surgeries in all Erie County hospitals effective Friday, December 4th. I do know that some of the hospitals were already stopping their elective surgeries, so it's not a huge lift for some of the hospitals, but all hospitals are now stopped from having elective surgery as of December 4th until such time as the state allows it to go back into place. And when it comes back, just I'll click back, with regards to hospitalization, and the governor talked about it earlier today, and we'll talk about it again, hospitalization is going to be a key metric going forward to determine whether or not a region will be going into a red or orange zone. COVID-19 fatalities by age and gender. Once again, this is been pretty standard that the older their age of the population, the greater the chance, if they get sick, that they can die. Though we have seen individuals who've died under the age of 40 in our community, under the age of 50, and we've had some recently in the under 40 and between the ages of 50 to 60, and it's just just completely saddening to see these statistics. We get the hospitalization reports every night, and it shows us the deaths in hospitals as well as in nursing homes. And on the 28th, there were 11 people that died in Erie County hospitals. There were 3 individuals who died in Erie County nursing homes. So 14 individuals died on the 28th from COVID-19. We do not have the data to prove whether or not those were Erie County residents. The nursing home ones should have been. But we also know the hospitalizations. We get hospitalizations from other communities, so it's possible that someone from another community had died. And once we confirm that, it will be added into the total. But effective as of the 26th, 803 people, unfortunately, have lost their life in our community due to COVID-19. And when it comes down and a breakdown in race and ethnicity, something that's very, very interesting with regards to the second wave, we are seeing a greater preponderance of whites die than we did earlier this year. The African American percentage of fatalities is dropping to one of the lowest it's been in quite some time, 15.4%, which is just slightly off the actual population of African Americans in Erie County, 14.6%. So in the second wave, we are seeing more whites actually perish than people of color. And it's really getting back down to more of the breakdown that you normally would see based on the population of Erie County. So this just once again proves that we're having an increased rate of infection, hospitalizations, and unfortunately deaths of individuals who live in the suburbs and rural areas. Not to say African Americans don't live in the suburbs or rural areas, but it's just proved once again that there seems to be more white people who are getting sick with COVID-19 based on the case data, the hospitalization data, and now the death data. I'll turn it over to Dr. Burstein and talk a little bit about what they're finding recently in schools and some other data before we discuss the issue with regards to the orange and red cluster zones, as well as the issues associated with the Back to Business program. So Dr. Burstein, let me fix this, spray this. And put on my mask.
Good afternoon. So as the county executive mentioned, we're seeing a lot of community spread and in Erie County, and that includes staff and students that attend our schools. So these are data looking at the number of students and school staff in among Erie County residents who have tested positive for COVID-19. And so you can see that it has been a significant number throughout the month of November. Even last week, when I think almost all the schools were virtual, definitely all the public schools and many of the private and parochial and charter schools were virtual, you know, we still saw a significant number of reported cases of 115. And this week, we're still seeing many cases. Actually, just today, there have been 44 cases of faculty, school staff, and students reported as positive from Erie, associated with Erie County schools. So again, we're seeing a lot of staff, and we are seeing students. And remember, we're not really seeing a lot of transmission within the schools. The schools seem to be a very safe place, and we're really seeing our people coming into the schools where they, they report that they've been in contact with people in their household or in gatherings that they've been to, and they happen to be working at schools or students at schools. So we're not, schools seem to be a safe place, especially the younger grades. So we're not really seeing a lot of transmission within the schools. So, because of what we're seeing in terms of transmission in our community, for Erie County testing, which remember is only a sliver of all the testing that's being done in Erie County, but for the testing from our public health lab and our rapid testing, we are just honing down to testing only people that are at highest risk, and those are people who are close contacts, whether they are symptomatic or asymptomatic, and then also people who are symptomatic that have COVID-like symptoms. So if you are an Erie County resident and you meet one of those categories, you can give us a call at 716-858-2929 to schedule. Remember, this is free. You don't have to worry about insurance or payment or doctor's order or lab requisition. Remember, they are by appointment only, and these clinics are getting very filled up very, very quickly. And so and we're also seeing a lot of no-shows. So we're asking people, if you're not going to be able to attend, if you change your mind, you feel like you're not going to test, or you found a place to get tested sooner than we're able to schedule you, please let us know so we can open up that spot to somebody else, because we are getting filled very, very quickly. So now we will talk about how Erie County responds. And I want to start by talking about contact tracing. So I know we've received a lot of questions lately about, where are people getting infected? And from contact tracing, we can't really tell you that. The goal of contact tracing is really to prevent transmission within the community. So number one, our goal is to inform people who have recently tested positive for COVID-19 of their diagnosis, making sure that they're aware that they are COVID-19 positive. And then number two, making sure that they have placed themselves in isolation, that they understand what that is, they understand how to do it, they understand how long it lasts, 10 days since the onset of symptoms, or if asymptomatic, 10 days from the date that you were tested. And then we're asking them, just because we have so many cases now, to notify their close contacts, so people in their home, people they may have been in gatherings with during the time that they may have been contagious, that those people were exposed, and that they should put themselves in quarantine and wait for a contact tracer to notify them, which will happen, in a couple days. However, we feel it's essential to notify people as soon as we receive those results from the New York State Health Department, that those individuals who are positive are notified, and they're aware of their status, and they're aware what they have to do, because that is the only way we're going to break the chain of transmission in our community. So again, through our contact tracing, we're not going to know where a person was absolutely infected. I mean, many times people have no idea. It could be from a household contact, it could be from a workplace, it could be from a social gathering at a restaurant or a gym or a movie theater, and they may not even know. So we're not really able to pinpoint exactly from our contact tracing where people were infected. However, there is a lot of great research in the medical literature that identifies where are the hot spots for people getting infected. And in our orange zone, many of those are limited to either being closed or the restaurants offering only takeout. So as I mentioned, we are making sure that everybody who is positive is notified. We actually have a separate army of Erie County staff that are separate from the contact tracers, that are calling everybody within 24 hours, leaving messages if they can't get a hold of them that they're positive. And we have a line that people can call back if they missed our call, and find out what their diagnosis is. So if you get a message, if you get a phone call from a phone number you don't recognize in a 716 area code, and you recently had a test for COVID-19, please answer the phone. It's critical that we give you this information. And then after we provide people with the information about isolation and quarantine, then contact tracers are going to follow up a couple days later. But people should not wait until they hear from a contact tracer to do the right thing. So I am going to turn over talking about the microclusters to our county executive.
Thank you, Doctor. As the governor talked about today, there's going to be some substantial changes to the cluster zone model from New York State, especially as it pertains to the orange and red zones. They will be determined based on emphasis to include looking at current hospital levels and future capacity, as well as staffing concerns and effective patient management. I think there's a general consensus that the positivity rate alone is not an indicative factor of what's going on in a greater community. And what the big concern is also hospitalizations and hospitalization rates. So I was on a conference call with the governor and other county executives on Friday, in which it was discussed with regards to this, as well as another conference call yesterday, in which it was another key point was that they looked like they were going to make changes announced today. And they did, that we don't have all of the parameters yet as to when a region goes from yellow to orange or orange to red. I did confirm with New York State earlier today that Erie County would not be going into the red zone today, and we did not. It's not to say it couldn't happen tomorrow, but I believe, as the governor noted, they're going to wait a little bit of time to see what kind of surge, if any, which we think will happen as a result of Thanksgiving. I'm not certain what the tomorrow will bring or Wednesday. So for those questions about when we would go into the red and what are the other parameters, we're still waiting for that documentation from the state. I think it's going to be a little different than what we saw before, but of course testing is key. We're doing lots of tests. You said over 50,000 tests were performed last week. Our positivity rate, it's not going down, stayed fairly average, but there's some days in which we've seen growth, and that's a concern. But we're seeing big growth in our hospitalizations recently, and that's a huge concern as well, because this is all about keeping people alive and reducing the number of people who have to go to the hospitals for COVID-19 versus everything else that somebody may have to go to a hospital for, whether it's a car crash, a heart attack, another serious illness. I expect to get more information from New York State with regards to some of these changes to the cluster zone model in the next 24 hours. And then with regards to school testing, this was a big discussion point with regards to the conference calls we had this week. New York State realized that there was no way they were going to be able to meet the 100% testing requirement in the orange zones or the red zones, and they want schools to stay open. There were many of us who advocated for a different type of system. I want to thank the members of the local school boards represented by Michael Cornell, the superintendent of Hamburg, who they recently sent a letter to the governor's office, as well as Lynn Fusco and David O'Rourke from BOCES 1 and BOCES 2. We had lots of discussions in recent period about what was attainable, and the state asked us, what do you think is attainable? The proposal that's now statewide is very similar to what our local superintendents thought was attainable here. They learned from what we could and could not do in Erie County based on the size of our population, and now it's a big change. Previously, if you were in the orange or red zones, you had to test 100% of staff and students on a weekly basis to determine what was the rate of infection in the schools. It is now 20% in an orange zone and 30% in a red zone for all staff and students combined, but that total of 20 and 30% is testing that amount over the whole month. They're required to test weekly, but they don't have to test 20% of their students and staff in a week. They have to test 20% of their students and staff in a month in the orange zone, which I know is going to make it much easier for the school districts to do the testing. We will be also informing some of the school districts about a change that Erie County Department of Health to help some of the smaller school districts. So the school district representatives should look forward to a communication from the Erie County Department of Health on that in the next 24 hours. We want students back in school, but we also want to ensure that it's a safe place for learning for the students, staff, and teachers. And that's why this change has been made. And I do have to say to the staff of the governor who may be watching, thank you, and thank you to the governor. I was on a conference call last week in which I said I didn't think they were going to change the protocols, and they did. We requested that they change the protocols, and they did. So thank you. We think this will actually ensure that students are in school being educated while also confirming whether or not that there's a possibility of a COVID-19 outbreak in any of the schools, which, as we note, so far has been few and far between, though there are occasional cases in school districts across our region. Once again, small gatherings seem to be causing 65% of the new COVID cases as determined by New York State. It's not too far off from the number that we see in Erie County. And we just remind everybody, if you're sick, stay home. Don't go to school, don't go to work, stay home. If you're an employer and your employee calls saying, I'm sick, say thanks, stay home. If you have any of the symptoms, you can get tested by Erie County and many of the other testing locations that are in the area. We don't want people who are sick going out and transmitting the disease. Now, good news. We have good news to announce. And it is the season of giving. And as a result, Erie County is giving away $19 million through our Back to Business grant program to nearly 1,400 small businesses across Erie County. In less than 3 weeks, the program received over 5,000 applicants, 5,022 to be exact, totaling more than $95 million in requests for assistance. And this just goes to show that the federal government needs to step up to the plate and do another round of small business assistance, because this was just small business requests or businesses 50 employees or less. Just over 3,000 of the 5,000 received made it to the final phase of review, which was performed by 43 North and a group of other organizations and individuals. In a total of 1,366 grants will be dispersed in 7 amounts. We originally announced 3, but 7 amounts ranging from $2,500 to $45,000, totaling $19 million. And the recipients, as well as those who may not receive anything, will receive notice of that today. I want to thank our team in Erie County government, led by Deputy County Executive Maria White and our Special Assistant for Economic Development, Andrew Federick, who worked tirelessly on this project, as well as the team from 43 North and many, many volunteers from M&T Bank, Ernst & Young, the Buffalo Urban League, to conduct the extensive review that was necessary to determine the 1,366 recipients. Just to go into some details, the money is being provided to the businesses with the greatest need. We had applications from businesses that have seen no revenue loss, or those that have actually seen increased growth this year, which has happened with some businesses. The money is being designated to those in the greatest need. 40% of the recipients received no or very negligible amounts during any previous COVID-19 programs, including the federal PPP program. And we want people to understand that we're trying to address the businesses that have the greatest need. 80% of awardees had 25% or more in annual revenue losses through from March to October. And 33% of the recipients had lost more than half of their annual revenue during that period. 30% of the awardees are minority business enterprises, while 60% of the awardees are women business-owned enterprises. 52% of the awardees are in highly distressed or distressed zip code tracts. 30 awardees were businesses that weren't allowed to reopen at a time of application, so some of those who applied actually had to shut down again, and those were 30 of the awardees. And 44 of the awardees were disabled veteran business enterprises. There's many different types of sectors that are included, though a small business sector, restaurants, personal care, which includes salons, barbershops, nail salons, and local retailers submitted the largest proportion. All applicants will be informed later today of the determination of their application via email from 43 North. So whether you're going to get a grant or not, you will receive an email from 43 North. And checks will be distributed starting today via certified mail to all the grant recipients. I want to thank the great partners at 43 North, including its president, Colleen Heidinger, and Lauren Baines, the VP of Portfolio and Management, and their entire team for the work that they did. We would not be able to distribute these CARES Act funds to our small business community recipients without the help of 43 North. They put in a tremendous amount of time and effort, so thank you to them. Thank you to also Congressman Brian Higgins for his support of this CARES Act program and for continuing to fight for additional assistance for small business. Now, some of you are probably wondering, we talked about a $20 million grant program, and they're doing $19 million of awards. The $19 million is the total amount that will be going out to recipients. There was additional $1 million that was used for the operation of the program, also paying and defraying the costs associated with 43 North and others that participated in the program review process. So this is $20 million in total, of which $19 million is going straight out to our partners. People wondered, we said we might be able to put additional money in. We basically don't have any additional money. Money's being spent on the rental and mortgage program. Money's being spent on the virtual learning centers. Money's being spent internally in Erie County government with regards to response, especially now that we've had to hire more contact tracers and more staff. So there wasn't more money. I wish there was, but there wasn't. The CARES Act funding is basically going to get used up completely by the end of this year. So with that, I will open it up to questions and answers, and just want to the media, and I want to once again remind everybody that we are deep in the woods of dealing with COVID-19. We're not out of the woods. We are still seeing increased caseloads, increased issues associated with our hospitalization numbers, and we all need to resolve this issue, everyone. If 25% of the population ignores it, we're going to continue to see growing caseloads and growing amounts of hospitalizations to the point where maybe our hospitals can't handle it anymore. The governor talked today about setting up field hospitals. We've already had those conversations internally and with the state. We're hoping we don't have to do that, but if we do, we will. It's just, it will be very difficult to man it. Staff is burning out in hospitals. They don't want to have to go through what they went through again in the spring. No one's coming in to save us from across the country earlier this year. We had folks come in from across the country to help us here, just like they helped New York City. No one's coming in from across the country because they've got their own problems. We got to do it on our own. And the best way to do that is to reduce the total number of cases. And I ask you to be a participant in that. With that, we'll open up to questions. Just a reminder to media, as I put my letter I have to mail here to remind myself, so it goes into the mailbox today. You need to hit *6 to unmute yourself if you are muted. We will start from the top. Is there anybody on from WKBW, Channel 7?
Hi, Mark. It's Madison.
Hi, Madison.
Hi. Question. So when you talked about Governor Cuomo waiting until after Thanksgiving, so are you saying that likely there won't be any adjustments to the zones until we see where the numbers go, maybe throughout this week?
Well, it's what the governor implied today in the phone call and what we sort of heard, but it's possible they could move us into a red zone sooner. Our numbers are, of course, the highest in New York State, and the hospitalizations are very high. We do know that there is bed capacity. There's some conflicting numbers that we're trying to get confirmation on from the hospitals, but we still know that there is bed capacity in total beds as well as ICU beds. But the governor did seem to imply that there would be a delay before they made any major adjustments across all of New York State. There is a possibility we could go into the red based on our numbers. There's no doubt about that. All I know is they told me they were not going to make a determination today, and they would consider it again in the future. Channel 4, WIVB, Chris Horvatis.
Hey, Mark. Happy late Thanksgiving. I was wondering if you could address school testing a little more. Did I accurately hear you say the county is now going to help some smaller school districts with testing? And can you?
No, we cannot help all school districts. We cannot help all school districts with testing.
So where would the cutoff be, I guess? How do you determine what?
That information will be coming from the Department of Health to our school districts in the next 24 hours.
Is it, you said the local superintendents thought the new plan was attainable. Can you elaborate on why this, but putting aside the mass testing, because of course I understand how great of an undertaking that would have been, but how is this more attainable than what was previously required?
Well, the School Superintendents Association, which represents Erie and Niagara County, sent a letter to New York State with what they thought was attainable here, which is more in line with what the state has announced. The Superintendents Association were hoping for less tests once they proved that they had hardly any. The state is requiring weekly testing. I think the locals wanted to do monthly testing. We think it's smart that they do weekly testing, but I am glad that they reduced the overall amount. And I would recommend that you contact the Erie Niagara School District Association or School Superintendent Association for the direct feedback from individual superintendents. I know that they feel that this is a overall organization. They feel that this is much more attainable than what originally was the 100% requirement. Kelly Dudzik, Channel 2.
Hi, for the school testing, what's the earliest that all that infrastructure could be put in place? Would it at least be a month if you started doing it at those levels today? Would you at least need a month of data before people could move back into buildings?
I don't know. I can't answer that question. The state is sending out the protocols today and tomorrow on the updates to the school. I don't know the answer to that question. Spectrum News, Erin Heaney.
Yes, hi Mark. This is a question I think more so for Dr. Burstein. What should people do who had elective surgeries scheduled that are now being canceled? I know there was a backlog of all of this back in the spring when the surgeries were canceled.
Thank you. So what we recommend is that people call the offices where they had these elective procedures scheduled and ask for guidance about how to proceed. And remember, this is just elective. So say, for example, an individual has symptoms, say they have rectal bleeding, and the physician recommends that they get a colonoscopy or to check out what's the cause of it. That's not an elective procedure. That's a diagnostic procedure. The person is sick. They have a symptom. It could be indicative of a serious problem, and so that procedure would need to be done to make a diagnosis and hopefully treat it. So this is just elective procedures, and people will have to call their providers where the offices will have it scheduled and ask for advice of how to proceed. Thanks.
Buffalo News, Aaron and Sandy, I think you're on.
Hi, Mark. So with hospitalization capacity being added as among the new metrics that are being added to determine whether or not we move into a red zone or orange zone, I'm wondering if that means because there are new benchmarks added, if that actually means that it is less likely that we would move into a higher zone or even stay in the orange zone. Because if you look at our capacity numbers, the 7-day average on the early warning dashboard, we still seem to have plenty of bed capacity and ICU bed capacity.
We're still waiting for the exact parameters. I think everyone's looking for the formula, thinking that there is an exact formula that says once this happened, this occurs. I think we realize that that's not the case. Otherwise, we would probably be in a red zone for most of Erie County at this point. And with the issues with regards to hospitalizations, I think that's going to take much more of the analysis than just the straight up how many new cases do you have, positivities. The microcluster formula was announced for microclusters. And this is not a microcluster. This is very large. I don't think they anticipated when they announced the microcluster formula they'd be applying it to a community the size of Erie counties. So they're making changes. I give them credit for making changes to ensure that we're protecting our greater citizens, but we're not doing anything more than we need to with regards to the shutting down and destruction of our economy. So I can't give you an exact answer as to what it all means with regards to yes, we're going to be in a red zone, or no, we're not going to be in a red zone, or do we stay in an orange zone? I feel very confident we will probably stay in the orange zone for the foreseeable future based on the conversations I've had with the governor and his staff and looking at the rates and numbers. They're exceptionally concerned. I think there was a concern among other county executives that were participating in the calls that the entire state was going to be put into an orange zone based on the conversations with the governor and his staff, because the rates are increasing everywhere. I think they're looking at this and realizing that they have to be nimble and make adjustments on the fly.
So would you agree, though, then, that moving up to a red zone, it seems like it's a higher bar now than it was before?
I would not agree until I find out exactly what they're looking for with regards to a combination of hospitalizations, new cases per 100,000. They still might move a portion of the community into a red zone and keep the rest orange. I mean, there's some areas that have very high numbers per 100,000, as we noted earlier, with regards to communities that are over 75 per 100,000. So I would not necessarily come to the conclusion that because they added hospitalizations in, that automatically means that it's unlikely that we'd go to the red zone anytime in the near future. I would not make that assumption.
Okay.
You're welcome. WBFO, anybody on from BFO?
Hey, Mark, can I get a question? This is Aaron from the news.
I'm here.
Well, let me go to BFO first, Aaron. We'll come back.
Okay, Mark, looking at the numbers around Western New York, how much are Erie County hospitals treating local patients as well as backstopping patients from the 3 southern counties?
I can't give you an exact answer to that question, Michael. We get the raw data of how many patients are in any one hospital. It does not say where they live, so I really can't answer that question. I do know from talking to hospital officials, they are receiving patients from outside of Erie County, but how many, I don't know. They'd be the ones that would be best to answer that question. WBEN, Brendan Keeney. No one from BEN? Okay, we have Julie from the Newsteader on.
Hi, Mark. Thanks for taking my question, and thanks for the job you guys have been doing for the past, I don't know, all the days run into one. 11
you.
months.
It's been a long
How
time.
many were into this? I'm in Akron, Newstead, and I live by the Erie County COVID map that you guys have up, the interactive map. And the Erie County COVID map shows cumulative numbers since March. And it doesn't show, weekly or whatever by the area. So when you click on my zip code, which is 001, for example,
Can you wrap it because we're losing you?
72. Is that better?
I'm going to have to move on. I think I get the gist of the question. The map is updated on a weekly basis, twice, I should say bi-weekly basis. It's updated bi-weekly. We do not, because of the issues associated with the map and truthfully the time constraints that are being put on our staff, have every bit of data that everyone would want, which is how many times a day it's updated and so forth, so that everyone knows the difference from day to day. There are updates that are done on a bi-weekly basis to the map, as it's broken down by town and zip code. That is the way we generally do
Right.
it. So, but I don't have.
Can you hear me now?
Yeah, but I'm gonna have to move on because we're running out of time. So you gotta be short on the questions, unfortunately.
Because we have 2 different numbers. It shows 2 different numbers.
Yeah, and that's, most other communities are like that. Some communities, like the city of Buffalo, has multiple zip codes. Town of Cheektowaga, Amherst have multiple zip codes. It's just the way it's
Right, but it
broken down.
shows 2 different numbers for the same zip code.
I'll have Department of Health look into that, but I'm not, I'd have to have them take a look into that, why there'd be 2 different numbers in the same zip code, because my understanding on the map, there would only be one, and then there'd be a separate number for the town of Newstead.
Yeah, no, it's just, you click on the map, it says 72. You look on the zip code, it says 109.
All right, we're gonna move on. I can't continue. We'll look into that. The next question, we'll go to Aaron Bessiker of the Buffalo News.
Hi, Mark. Thanks. Earlier, you mentioned that small gatherings statewide seem to be 65% of new cases, I think you said, and you said it was similar in Erie County. Just want to clarify, that's coming from contact tracing data locally, and what about the other 35%?
Well, 35% would generally be the all other situations, as they can determine. As Dr. Burstein knows, it's not always easy to determine the actual, how somebody caught it. We do know, based on the information that we had, that we can see a lot of cross-pollination, so to speak, of individuals in small gatherings and households that are catching it from another. So that's all considered part of the small gathering amount. If you have 4 people in a household and 3 of them test positive, in all likelihood they caught it in what would be considered a small gathering in their household. The same thing goes if you had 15 people, which you're not supposed to, but if you had 15 people come together in a room and 6 of them test positive in a very similar time period, you're going to assume that they caught it from one of the other individuals, though it's very difficult to ever prove exactly how much or who it was caught from. It's the problem that we have is a lot of people like to want to know well, how did I get it? And the answer is, we're not certain. We think you may have caught it from this area here, but we're not 100% certain. We'll go back to WBEN. Nobody from BEN?
Hey, Mark, can you hear me?
Yes, who is this?
This is Brendan.
Okay.
Are there any theories as to why the city isn't struggling as bad with the new cases as the suburbs?
I really don't have anything in one particular other than the city had been dealing with it for a much longer period at a higher rate of infection. And we do know from talking with our partners, including leaders of houses of worship and others, that there was a strong effort that was being made to remind everybody that COVID is still here. I think also it has to do just basically with there seemed to be this feeling as we were going through the fall that, okay, our COVID numbers are going down, and there were more gatherings at homes than probably in the suburbs and rural areas than what we were hearing was occurring in the city. It's not to say the cases aren't coming from the city. We are getting cases. We're just not getting them at the same rate we were earlier. And I think a lot of it has to do with people in the city understanding, having dealt with it for basically a longer, stronger period than what some of the other areas were. It's not to say Hamburg or West Seneca or Lancaster didn't have cases earlier, or Springville or Wales, which has had a high rate this most recent period. They had cases, but they just didn't have as many of them as they're dealing with now as compared to the city, where there were a lot of people who knew a lot of folks who had COVID. Now you pretty much can't go anywhere in the county without talking to someone who knows someone who's got COVID. So I think it's more spread. It just took a little longer because of maybe not being there at the beginning. Any other questions, Buffalo News? One more.
Yes, the governor had mentioned the need for there to be patient balancing among hospitals within the same network. He particularly called out ECMC and Collide Health. I'm just wondering if you had any insight into that, and whether or not you know from your conversations with hospital officials if this is an issue for hospitals here.
Well, ECMC's only got one hospital, so it's not like they've got multiple hospitals. Kaleida has multiple hospitals, but not a lot of them like they used to. We're really talking about Buffalo General and Millard Fillmore Suburban, which I know they both have had lots of patients throughout, so it's not like one have many more. Oshai Children's doesn't really count because of its just being a different type of hospital that it is. So Kaleida has some hospitals that you could say, I know they partner with, but I don't know if the governor was trying to be an equal opportunity criticizer earlier, because I know it was an issue in some parts of the state. I don't believe it's an issue to the same extent here, just because the networks aren't as large, and there has been hospital cases across or in all of these hospitals. When we get the report, it's not as if there's a hospital that has no COVID patients. They all have COVID patients. It's a question as to whether or not they are dedicating one hospital more than another. And when it comes to ECMC, it's only one hospital. When it comes to Kaleida, it's got two main hospitals, but they both have had a fairly large supply of patients, so to speak, the counts of patients. So I'm not exactly certain if that was just the governor trying to remind every one of the hospital units that they need to be equal. Spectrum News, Aaron, any more questions? If not,
Sorry, one more question. The governor said earlier today that he's reserving the right to put New York back into New York pause mode. Just wanted to know what your reaction to that is.
The governor has the right to do it. And as I said, I think there was some kind of thought by members of the call team that we were on that there was a chance the whole state of New York was going to go into the orange zone. They've made changes, I think, to ensure that we are protecting the public. And we're also trying to not decimate our economy once again. So I would just note that the governor has the power under the legislation that was passed last year by the Assembly and Senate to make these determinations. Some people don't like it, but he was lawfully given the power, and he has the power to do it. Channel 2, Kelly Dudzik, any more questions?
Yeah, as far as we've been in the orange zone, how has compliance been for businesses? Have you received more or less complaints? I know we've all reported on that one gym, but have you had to issue any fines or anything?
No, actually, the compliance has been pretty good. Our Department of Health actually sent out information to retailers prior to Black Friday, telling them what the expectations were and what they should expect from us, so what the expectations were with regards to capacity and what we wanted to see from their stores. And we had people out on Black Friday. We've had people out over the weekend. The compliance has been pretty good. We have the issue with the one establishment, though I'm glad to hear that that establishment decided not to open on today. It was a smart decision based on a number of factors, I think, that went into the calculus. And I just want people to understand that we're doing the best that we can to protect the general public. We have sanitarians that are going out there and health inspectors, and the compliance has been pretty good. If we are getting reports, and we do get reports from the public, whistleblower reports, we send out folks. If we get a report at 8 o'clock at night, we might not be able to get someone out there that night, but we'll try to get someone out the next day to determine whether or not a bar or restaurant was illegally operating. We've heard rumors of speakeasies, so to speak, bars that are running behind the scenes. We're sending out our inspectors if we get any good rumors on that to ensure it's not true, and I don't know why any bar would do it because they put at risk their liquor license. The governor's been pretty adamant they'll pull their liquor license, which means you're out of business. So far, pretty good. Channel 4, Chris Orvatis, any more questions?
Yeah, one more on school testing for you. Governor mentioned orange zone, yellow zone.
I'm losing you, Chris. Can you get closer to the phone? I'm just losing you.
Yeah, sorry. Are there still any requirements for schools in yellow zones to test? The governor did not reference anything on that area today.
I think it's still 20%, but we're waiting for further guidance. I was told that yellow zones hadn't changed, the rules associated with it, but we are waiting for a little bit more guidance. And finally, Madison Carter, Channel 7.
I'm all set, thank you.
Okay. Thank you, everyone. We will have another update later this week. We're debating whether it's going to be Wednesday or Thursday. It depends on a couple factors. But I just want to thank everyone for their good work. I know a lot of folks and families were separated during this past Thanksgiving, and they were doing it for their loved ones. May not wanted to do it. I didn't see my parents. I didn't go over to my brother's house like I normally do. We were separated, and I just want people to understand we do this year so we can all be together next year. It's no fun, I agree, but we are in this together. We want to continue to protect the general public. We want to continue to watch the Buffalo Bills play. We know the NFL is stopping some games where teams have high rates. We want to see the Bills play. Our winning Buffalo Bills, our first place Buffalo Bills. I'd hate to see the season stop because of COVID increases here or elsewhere. It would be the most 2020 thing ever for the Bills to be on this big run and all of a sudden have the season stop because of COVID. And the best way to ensure that they continue, at least on our end, is do your part so that we're not continuing the further spread of COVID in the community. Be your brothers and sisters' keeper. Be Josh Allen's keeper. Be Tre'Davious White's keeper. Be everyone else's keeper so that they can get back on the field and beat the 49ers next week, which will certainly make me happy and a certain local reporter not so much. With that, I wish everyone best wishes. Be safe and well. Take care. And wear your mask.